Hello, hello, hello. Welcome to New Trial Zone once again. And today we are going to talk about are psychologists really difficult clients? What do
Hmm.
you think, Ambrish?
I mean, what can be the challenges?
I mean, if you look at the challenge, there are two perspectives here that we need to consider, right? First is a mental health professional, that is MHP, as a client thinks that they are difficult client. And the
Hmm.
second perspective is the therapist who is going to take a mental health professional as a client. Challenges are
Hmm.
on the therapist. So,
Okay.
first, let's take an MHP as a client. Then we will
Hmm.
think about the perspective or the POV of the therapist who is an MHP who is taking MHP as a client.
Hmm. Okay. So, on that note, around three, four tangents are coming to mind. तो पहला is the imposter जो आजकल लोग इस्तेमाल करते हैं बहुत casually कि मेरे को imposter syndrome हो रहा है. And somewhere what I've noticed is, and this is based on conversations with multiple MHPs who have shared their
Mhm.
challenge being a client themselves कि मैं खुद एक therapist हूँ. I should be able to deal with my own things. Why am I not able to? That's one of the things that I have noticed.
अरे कहना क्या चाहते हो?
Okay, I have to. It is like a cardiologist wishing कि मैं खुद ही अपना बाईपास सर्जरी करूं. मैं इतना अच्छा कार्डियोलॉजिस्ट हूं.
Hmm.
मैं क्यों नहीं कर पा रहा?
Hmm.
बात तो सही है.
So, yeah, sorry to cut your chain of thought there, but I really had to, bring in that irony.
Hmm. Indeed, yeah, irony he hai, and I completely agree on it. But somewhere we are expected to be able to deal with our own emotional burdens and packages. The dusra tangent that I am noticing here is, will I be judged by the therapist?
Mm.
What will they think about me? It's somewhere kind of connected to the first point itself, but from a little different tangent. They expect me to be able to deal with my own emotions. They expect me to know certain things and all those things. That is one thing that I've noticed. The third tangent that I have noticed here is,
Can I stop you right there?
yeah,
Can we take each tangent one by one,
hmm,
speak about those
okay,
tangents and go to the next one?
okay,
So, first one, I really spoke
hmm,
about it. It's the irony.
hmm,
Second one, will I be judged?
hmm,
And I'm supposed to know certain things because as a client, even I am an MHP,
hmm,
right? So the answer to that from my perspective would be,
hmm,
okay, yeah, because so I'm gonna continue using the cardiologist as an experiment, okay?
sure, hmm,
So yeah, because I am a cardiologist, I will know how to take care of my heart
hmm, hmm,
because I have studied all my life to do that. But let's say if I have a genuine problem, I have to go to another cardiologist despite me being a cardiologist. And the other cardiologist will judge me. Okay, why did I not take care of my heart's health?
क्या बात कर रहे हैं?
Having said that, during during the course of treatment, during the course of the journey, I will be expected to take care of my heart. That is the basic because I have
hmm,
studied for it.
hmm,
If I am not able to, the cardiologist that I'm consulting will remind me my studies,
correct,
right? Will
hmm,
remind me to take care of my heart's health and heart's hygiene.
hmm,
Every day, what to do, what not to do, probably guide me on my lifestyle. Maybe I'm living in a place where the food is not matching my palate. The food is
Hmm.
causing a lot of cholesterol. So probably cut this down, increase greens more,
अबे जल्दी बोल कल सुबह पनवेल निकलना
things like that.
True, true.
What's the harm in another MHP judging this MHP who's coming as a client?
Hmm. Hmm.
Judgment will be there.
Agree. This kind of brings another sub tangent of it. कि अक्सर लोग नॉन जजमेंटल विच इज सपोज टू बी वन ऑफ द कोर पिलर्स ऑफ थेरेपी, लोगों को लगता है कि हमारे पास जजमेंट होंगे ही नहीं. हाउ इज इट रियली पॉसिबल?
No, that even I strongly disagree with. क्योंकि मैं जज कर रहा हूँ इसीलिए तो मैं एक अच्छा थेरेपिस्ट हूँ. I am knowing which modality to use, which homework to give based on the problems that are on the table. तो वो बेसिक जजमेंट स्किल्स तो मेरे में अच्छी हैं, इसीलिए तो मैं अच्छा थेरेपिस्ट हूँ. पर I will not judge the content of the story which you are telling. उस पे मेरा जजमेंट नहीं होगा. ठीक है, तुम्हारी जिंदगी है, तुमने ये डिसीजंस लिए या तुम्हारे साथ ये हुआ, उस पे तुमने ऐसे रिएक्ट किया, फाइन, उस पे मैं जज नहीं करूंगा.
क्या बात है सर, क्या बात है सर, क्या बात है, ये बात है. अरे सर क्या बात है.
पर वो हुआ जिसकी वजह से एज अ कॉन्सिक्वेंस यू हैव अ पुअर मेंटल हेल्थ. अब मुझे जजमेंट तो लेना ही पड़ेगा ना कि अब क्या एक्टिविटी देनी है, कि क्या इंटरवेंशन लेना है, कि क्या ट्रीटमेंट प्लान करना है. जजमेंट कॉल कहते हैं उसे. सो इट इज नॉट अ ब्लैंकेट स्टेटमेंट कि आई विल नॉट जज यू एट ऑल. इट इज अ नॉन जजिंग स्पेस फॉर योर स्टोरीज कंटेंट, फॉर योर नैरेटिव. बट me as a professional, I'll be judgmental.
क्या ट्रू?
Yeah.
बहुत लोग उसको पैराफ्रेज करते हैं, सिनोनिम यूज करते हैं, इन्फॉर्म्ड डिसीजन, असेसमेंट. मेरा एंड ऑफ इट तो है जजमेंट.
जोर जोर से बोल के लोगों को स्कीमें बता दे.
Yeah.
So the third tangent that I've noticed in terms of challenges being a client as an MHP, वो ये है कि they think and feel उनके प्रॉब्लम्स बहुत बड़ा है. कि will the therapist be able to handle my problems? They kind of glorify their problems, probably because they know the terminologies and are able to use a very theoretical lens. But yes, this is another challenge that I have noticed.
This I sort of agree with. क्योंकि हर एक को हक है अपने प्रॉब्लम को बड़ा समझना या छोटा समझना, वो उनका परव्यू है. If MHP as a client walks in thinking that their problem is big, I will treat it as big. Because हमने trauma informed studies में भी तो देखा है, the severity is decided by the client itself. तो I am nobody to tell कि नहीं तुम्हारा बहुत बड़ा नहीं है, तुम्हारा छोटा है. वो तो same privilege which is offered to a layman client, we will offer the same privilege to an MHP client also.
Yeah.
But why does it necessarily make MHP a difficult client? I am still not seeing the
To be honest, उसका आंसर अभी तक मुझे भी नहीं मिला है. I am sharing based on the conversations that I've had and
Correct.
wanted to bring this as a topic to just discuss and
No, I'm not disagreeing with you. I'm disagreeing with the point of view.
Agreed.
Yeah.
तो ये वाला जो point है, which in a way also connects to the second aspect जो तूने कहा. Why is it difficult for MHPs to have MHPs as clients?
That is the second POV, है ना?
Correct. And somewhere जो third वाला point कहा मैंने, because they are already coming with that amount of knowledge, theoretical prowess. कभी-कभी the therapist feels intimidated to have a therapist as a client. Will I be able to serve them well? Will they already know what to do? ये सारी चीजें आ जाती है.
वहां पे तो देखो तुम्हारा intimidated feel होना जायज है, because continuing the example, if a cardiologist is coming to a cardiologist, they will talk in a highly scientific language, which is based in Latin. They will know the terms in and out, right? कि मुझे ये प्रॉब्लम है, अच्छा ये टेस्ट का रिजल्ट क्या है. They will ask very specific pinpoint questions.
Oh my God! Wow!
तो तुम्हारी साइकेट जो है उस लेवल की होनी चाहिए कि
Agree.
तुम क्लाइंट को वो सेंसिटिविटी के साथ बता पाओ जो क्लाइंट को पता होगा, पर ये समझाना कि तुम्हें एज अ स्टडी मटेरियल ये पता थी, पर अब ये तुम्हारे साथ हो रहा है,
Yeah.
वो रियलाइज करवाना विद दैट सेंसिटिविटी. और यहाँ पे आई विल टेल यू वन मोर थिंग कि कॉम्पिटेंसी हाई होनी चाहिए है,
Agree.
राइट? बिकॉज उस लेवल तुम यहाँ पे जैसे लेमैन क्लाइंट्स को रैंडम साइकेट दे दिया, थोड़ा रैंडम मेटाफर्स दे दिया, जो कि आजकल इंस्टाग्राम में भी घूम रहा है, जो कि मनोज बाजपेयी ने फैमिली मैन में बोला था. ये कोट्स के लिए आ रहा हूं मैं यहाँ पे, ये कोट्स, डर के आगे जीत है.
समझ रहे हो? समझ रहे हो आप? समझ रहे हो?
ये मतलब वो नहीं चलेगा. यू हैव टू बी हाईली टेक्निकल, highly skilled, and you have to explain the gap what the MHP as a client is not seeing. So yeah, practical application prowess high honi chahiye, theoretical knowledge prowess bhi high honi chahiye. That I agree.
So यहाँ पे one gap that I'm noticing is on one hand जब एक MHP client करके आते हैं, we need to have the theoretical prowess to bring the technical aspects. Whereas जब एक non MHP client करके आते हैं, we also need to have the prowess to make it layman dumb proof. हम
Yeah.
उस बैलेंस में खो जाते हैं.
Yeah, correct. क्योंकि जो रेगुलर क्लाइंट्स MHP देख रहे हैं उन्हीं के लिंग्विस्टिक्स की प्रोग्रामिंग हो जाती है. तो when MHP comes in as a client to an MHP, linguistics reprogram करना पड़ेगा ना for a
Yeah.
MHP. So yeah, that is a gap, but it's not that difficult because you know whom you are catering to. It is one-on-one. It is not one to many that you have to simultaneously adjust the language to fit both the extremes. वो तो नहीं हो रहा है यहाँ पे.
Correct.
So इतना बड़ा गैप भी नहीं है, because when you are taking in MHP as a client, when you are also an MHP, you know कि ये होने वाला है. So you can probably put in slightly bit more effort. तो मेरा सवाल ये है कि क्लाइंट का POV, क्लाइंट जो एक साइकोलॉजिस्ट है, वो अगर कहता है कि ओ इट इज डिफिकल्ट टू बी अ क्लाइंट एंड गो टू सीक थेरेपी, मैं तो बोलूंगा कि वो क्लाइंट विक्टिम कार्ड खेल रहा है.
Agreed.
और दूसरा, अगर MHP जो कि दूसरे MHP को एज ए क्लाइंट ले रहा है, मैं तो बोलूंगा कि वहां पे उनको कॉम्पिटेंसी लेवल बहुत बढ़ानी चाहिए.
Agreed again.
Right? Probably the only gap that I am seeing is finding a right competent fit.
Yeah.
तो अगर तुम्हें पता है कि you are an MHP, you are doing ample networking, you know the people in your field, you probably are regularly upskilling yourself, सब कुछ कर रहे हो, तो किसी ना किसी को तो अपना MHP बना लो एज एन MHP. तूने और मैंने भी तो ऐसे ही किया था.
Exactly.
राइट, बट वी डिड नॉट स्टे स्टक. इसलिए आज जहां पे है वहां पे है.
True. And जैसे जैसे हम लोगों का एक्सपीरियंस बढ़ा, the more skilled we became, we also kept on changing therapists to match our level of wavelength.
So, title hypothesis.
Hmm.
Are psychologists really difficult clients?
I think I would let the viewers use their discretion to answer this question for us.
Viewers, let us know in the comment, okay, what is the difficulty all about? And oh, that reminds me,
Hmm.
can supervisors help you navigate your therapeutic journey?
I would say absolutely yes.
Yes, because every MHP should have a therapist and a supervisor, है ना?
Yeah.
क्योंकि मैंने बहुत रिसेंटली एक लिंक्डइन में पोस्ट भी पढ़ा था, how clients are not respecting the investment that a therapist makes in their career.
Hmm.
They have to regularly undergo therapy, they have to regularly take supervision, and regularly upskill themselves.
Yeah.
So these are the three regular investment they spoke about. However, nobody speaks about the assimilation of all these three. So
True.
can supervisors, or you already agreed, how do supervisors
Hmm.
help the MHP to navigate their therapeutic journey?
To answer this, first I would give a disclaimer. That is, it is very easy to blur the lines between a supervisor and a therapist.
Oh, yeah.
However, one rule of thumb that I personally use being a therapist and a supervisor myself is कि जो भी चीजें इमोशनल हो, पर्सनल हो, past related baggages हो, those are domains of therapy. But when it comes to the aspects of skills or practical navigations in the journey of being a therapist, वो supervision में आ जाता है. So there would be certain midpoints. Like as supervisor, I can help them identify कि आपके ये जो professional challenges आ रहा है, these can be explored deeper in personal therapy.
Because personal limitations are holding you back
Yeah,
for your professional growth.
correct.
Okay. Like how you have a rule of thumb.
Hmm.
I have a formula. I have a like जैसे कि बीटी कहते हैं ना, बीटी से दूर रहो.
हाँ,
हमारे लेमैन लैंग्वेज में बीटी मीन्स बैड ट्रिप.
हाँ,
मेरे लिए एज अ सुपरवाइजर बीटी मीन्स biases and transference. See, as a supervisor, a good formula, no?
and biases and transparency can give you a bad trip.
Bad trip, right? So my formula is simple, BT, right?
Hmm.
So biases identify कराना supervisor का काम है.
Yes.
Biases पे काम करना therapist का काम है.
Agree.
ठीक है? ट्रांसफरेंस आइडेंटिफाई करना सुपरवाइजर का काम है. ट्रांसफरेंस क्यों हुआ उस पे काम करना थेरेपिस्ट का काम है.
Yeah.
So
This is
identification is our responsibility as supervisors. And if I am a therapist to an MHP working on these transferences and biases कि तुम्हें क्यों biases आ रहा है या तुम्हारा transference क्यों हो रहा है, उस पे काम करना as a therapist who is taking MHP as a client is their responsibility.
So, एक प्रकार से, if I summarize what you said, as a supervisor, I am more of a diagnostician, diagnostic role, whereas intervention is the therapist.
Yeah. D versus I, DVI, right? Very good. So in conclusion, I think there is nothing more to add to this topic.
Yeah, I think
right?
let the viewers take the conversation forward with the hypothesis.
Very interesting, very interesting. So conclusion क्या होगा वो आप ही बताइए कमेंट सेक्शन में.
Yeah.
अगर ट्रिगर हुए, अगर ट्रिगर हुए, so this might be a good indication to start your therapy at the earliest. Because trigger
or
हुए.
and to put it in आजकल की lingo, let the trigger be the warning to take therapy.
That's it, folks. That's it for today's. See you in the
Yes.
next one. If you liked it, please like. If you feel your fellow MHP is putting off therapy, but you think they need therapy, share this with them and subscribe. See you in the next one.
Yes. See you. Take care.